Did you know that nearly 9 million people die each year from hunger and related causes? Today, we delve into the pressing issue of global malnutrition, exploring its root causes and potential solutions to address this critical challenge facing humanity. Global malnutrition is a multifaceted problem affecting millions of people worldwide, particularly in developing countries. It manifests in various forms, including undernutrition, micronutrient deficiencies, and overnutrition. Solving global malnutrition requires a comprehensive approach that addresses the underlying causes, implements effective strategies, and fosters international cooperation. At the core of global malnutrition are several key factors: poverty, lack of access to nutritious food, inadequate healthcare, poor sanitation, and insufficient education. These interconnected issues create a vicious cycle that perpetuates malnutrition across generations. To break this cycle, we need to tackle each of these factors holistically. First and foremost, addressing poverty is essential in combating malnutrition. Poverty limits people's ability to purchase nutritious food and access healthcare, clean water, and sanitation. Economic development programs that create jobs, increase incomes, and reduce inequality can significantly impact malnutrition rates. Microfinance initiatives, vocational training, and social protection programs can empower communities to lift themselves out of poverty and improve their nutritional status. Improving access to nutritious food is another critical component in solving global malnutrition. This involves enhancing agricultural productivity, ensuring food security, and promoting sustainable farming practices. Investing in agricultural research and development can lead to higher crop yields and more resilient food systems. Additionally, supporting smallholder farmers and improving rural infrastructure can facilitate the distribution of food to remote areas, reducing hunger and malnutrition. Food fortification and biofortification are effective strategies to combat micronutrient deficiencies. Fortifying staple foods like rice, flour, and salt with essential vitamins and minerals can help address widespread deficiencies. Biofortification, which involves breeding crops to increase their nutritional value, is another promising approach. For example, biofortified crops such as vitamin A-rich sweet potatoes and iron-fortified beans can provide essential nutrients to populations that rely heavily on these staples. Healthcare and nutrition programs play a crucial role in addressing malnutrition, particularly for vulnerable populations like children and pregnant women. Integrating nutrition interventions into primary healthcare services can ensure that individuals receive the necessary support to maintain good nutritional status. Programs such as breastfeeding promotion, vitamin and mineral supplementation, and treatment of acute malnutrition are vital components of a comprehensive healthcare approach. Improving sanitation and access to clean water is also essential in combating malnutrition. Poor sanitation and contaminated water sources can lead to diseases such as diarrhea, which can cause severe malnutrition, particularly in children. Implementing water, sanitation, and hygiene WASH programs can significantly reduce the prevalence of these diseases and improve overall nutritional outcomes. Education is another critical factor in addressing global malnutrition. Educating communities about nutrition, hygiene, and health practices can empower individuals to make informed decisions about their diets and lifestyles. School feeding programs, which provide nutritious meals to children, can improve educational outcomes and nutritional status simultaneously. Additionally, educating women and girls in particular can have a profound impact as they are often responsible for food preparation and childcare. International cooperation and policy interventions are essential to effectively address global malnutrition. Governments, international organizations, non-governmental organizations, NGOs, and the private sector must work together to implement and scale up successful nutrition programs. Political commitment and adequate funding are crucial to sustaining efforts to combat malnutrition. Policies that promote food security, support smallholder farmers, and prioritize nutrition in national development agendas can create an enabling environment for lasting change. One successful example of international cooperation is the Scaling Up Nutrition (SUN) movement, which brings together governments, civil society, the United Nations, donors, businesses, and researchers to combat malnutrition. The SUN movement focuses on evidence-based interventions, country-led approaches, and multi-stakeholder collaboration to address the underlying causes of malnutrition and improve nutritional outcomes. Technological innovations also hold great potential in addressing global malnutrition. Mobile health, mHealth initiatives can provide valuable nutrition information and support to remote and underserved populations. Digital platforms can facilitate the delivery of nutrition education, monitor nutritional status, and connect individuals with healthcare providers. Additionally, advancements in agricultural technology, such as precision farming and genetically modified crops, can enhance food production and improve food security. Community-based approaches are vital in addressing malnutrition at the grassroots level. Engaging communities in the design and implementation of nutrition programs ensures that interventions are culturally appropriate and sustainable. Community health workers who provide essential health and nutrition services can be instrumental in reaching vulnerable populations and delivering targeted support. Moreover, addressing gender inequality is crucial in the fight against malnutrition. Women and girls often face barriers to accessing education, healthcare, and economic opportunities, which can exacerbate malnutrition. Empowering women through education, economic opportunities, and social support can have a transformative impact on nutritional outcomes. When women are empowered, they are more likely to invest in the health and nutrition of their families, breaking the cycle of malnutrition. Addressing the impact of climate change on food security is also essential in solving global malnutrition. Climate change affects agricultural productivity, food availability, and nutrition security. Developing climate-resilient agricultural practices, promoting sustainable land use, and investing in climate adaptation measures can help mitigate the impact of climate change on food systems and ensure that communities have access to nutritious food. In conclusion, solving global malnutrition requires a multifaceted and integrated approach that addresses the root causes, implements effective strategies, and fosters international cooperation. By tackling poverty, improving access to nutritious food, enhancing healthcare and sanitation, promoting education, leveraging technological innovations, and addressing gender inequality and climate change, we can create a world where everyone has the opportunity to achieve optimal nutrition and health. Did we miss anything? Let us know your thoughts in the comments below, and thanks, as ever, for watching.